Hey, welcome back, everybody. It's time once again for another episode of Living Hope, a weekly journey designed to provide hope, inspiration, and education for those living with pancreatic cancer, sharing the real-life stories of those really affected by this deadly disease and how they deal with it on a daily basis. With a woman, well, she's been dealing with it for a day or two here. Let's bring in Roberta Luna here.
Thank you, Paul. It's been many days. I should actually count down how many days are in 20 years, right?
When is your anniversary? Is it in April?
April 1st, April Fool's Day.
You were fooled on April Fool's Day.
That's right, and I fooled them too, didn't I?
So 21 on April 1st.
Yeah, I'll be 21 again. How about that?
And-
How many
and
people can say they do 21 twice, right?
And does she know, like everybody else knows on this show, that on April, the first week of April, to celebrate, you're going to jump out of an airplane?
Yep, on April 8th, we're taking another leap of faith.
Wow.
How many is this?
It'll be my 10th jump.
Wow.
Yeah.
Wow.
And is Vic joining you?
We're not sure yet. We have to kind of wait and see because he got a new insurance policy and it tells him he can't. So.
I'll tell him he can't. If the insurance does it, he can't.
Yeah,
Don't
now that he owns a business, it told him he can't jump. So I don't know. We'll see.
We'll find out. Okay.
Today, I'm very, very excited for a number of reasons, but especially to have Amy Reiss with us today, from Patient and Family Support Coordinator with the Hirschberg Foundation for Pancreatic Cancer Research. That's a mouthful.
It is.
Thank you for joining us today. I'm really, really excited. Like I said, I've been working on you for a long time, so I'm glad you finally gave in or something. I don't know, but I really appreciate you being here. So could you just give us a little bit about what it is that you do with Hirschberg?
I do. First of all, I get one-on-one with you today. So that's the plus.
Oh, thank you.
Every time we see each other at events, we don't get to sit down and have a conversation.
Right, it's so quick.
This is our conversation today. I am the Patient and Family Support Coordinator, as you said, for the Hirschberg Foundation. And so when I get calls or emails from people who've been newly diagnosed or families that are dealing with a diagnosis, and I share patient resources. So my job is to educate, empower, and help someone join our community so they don't feel alone.
Do you do this for any reason? Do you have a connection personally with pancreatic cancer?
I do. I have a familial history. Lost my mother to pancreatic cancer, and her father and her mother. So it's my mom and my grandparents, my maternal grandparents, to this disease.
Well, I don't know why I didn't know that before. I'm sorry. We even have more of a connection than I realized because, both losing many family members to it.
Many family members. And when I heard your story, I, of course, related to it. It's, when the first person in your family is diagnosed, you don't know quite what that means. But when you start to have multiple members, then as I've learned with this position, I'm now a high-risk individual. But I say that I'm one of the lucky ones because I know to look for it. And we know with this disease, it comes out of the blue for the majority of people. So with early detection programs and high gear all over the country, I feel like those in your position or my position or our family members, we know to get diagnosed, for diagnostics, whether it's endoscopic ultrasound or whether it's MRI, and stay in touch with our gastroenterologist and just keep up to date with scans.
Yeah, it's very important because I think, like many of us, at least me, I didn't even think about pancreatic cancer. I didn't even know, anything. I didn't think about it, what the pancreas does or what it is, until I heard Michael Landon, talk about his diagnosis. And then, sadly, after his death, I really never thought about it again, until it hit my family and then my dad, and then finding out, like you say, the family history. So knowing what your pancreas does, looking for the symptoms, it's early detection is really, really important. Hirschberg is doing something. I think this is their 17th year for doing it.
It is.
Something that I look forward to going to every year. I sound kind of weird, but it's not only connecting with other people, survivors, patients, caregivers, but the resources you offer. So could you tell us what it is that's happening and when it is happening?
I can. So on Saturday, March 11th at the UCLA Luskin Conference Center, we'll be having our 17th Annual Symposium, and it's really it's for the layperson. It's for the patient, who's newly diagnosed. It's for the survivor who's been around for a while and comes back into the fold and shares their stories with other people in the community. And we have a fantastic lineup of presenters this year. And each year at the end of our symposium, we have an evaluation form filled out. And so one of the questions is, what would you like to see next year? Or what topic would you like to have tackled? And so we take those very seriously. And this year, a lot of what's come up in the last year or two is now part of this year's symposium.
What are some of the items you're going to be tackling? What are some of the things that patients from the past have asked for?
So our first speaker is Jenny Tran from the Simsman UCLA Center for Integrative Oncology. And Simsman is a nonprofit group that if you're a patient at UCLA, they're there for you to help guide you through a diagnosis. And that subject is turning down the volume on worry, managing cancer-related anxiety. And that's just for all of us to be able to manage anxiety, but in particular for anyone going through a diagnosis like that. So it's for the patient, it's for the caregiver, it's for the family, everyone. As you know, when one person is diagnosed in the family, it's really everybody that is affected. So that's going to be a great conversation, and Jenny has a one-sheet on a worry workshop that people will be able to take home with them and refer to. So that's something that we feel is important to present. I can go on.
Yeah, no, please do. I want everybody to get an idea what's there. I mean, and I think what she's going to be talking about is really important because we always go through what we call scanxiety.
Yep.
It's something that when it's time for those scans to come up, and I don't know why these darn people who schedule it decide to schedule it on a Thursday or a Friday, because then you have to go all weekend and wonder what the heck's going on until Monday or Tuesday.
Right? It's always Thursday or Friday.
Exactly.
Late in the afternoon. And you know you're not going to get results right away. Yeah, and that's just consistent. I mean, if I talk to survivors even 5 years out getting a scan, that it doesn't go away, that scanxiety, as you said. So it's just something that I think everyone can benefit from hearing this Jenny talk about her workshop. We have Shelby talking about, her last name is Yekazeko, and I know I'm not pronouncing that correctly, but she's talking about dietary management post-diagnosis. And that means from day one. So Shelby works at UCLA, and she's involved with the IPU, the Integrated Practice Unit at UCLA. So anytime a patient comes through and sees a doctor, they're connected with Jenny or someone on her team to learn about nutrition. And as you know from past lectures with Dr. Lee at UCLA, it's important from day one.
And will she be able to touch on using the pancreatic enzymes? Is that something she touches on as well, or is that something different?
Yeah, she'll be able to speak about enzymes, when you use them, how you should use them. Of course, some people don't get the best direction on how to use them, and so therefore it's not helpful. Shelby will be able to speak to that. And she's her position is funded by the Hirschberg Foundation, and it's a great addition this year to the team to be able to direct people to Shelby if they haven't already met her.
Yeah, because one of the biggest questions I always get and hear from other patients and survivors is exactly the enzymes, because they just give them to you and say, here, you take these with meals. Well, it varies. How many do I take? So to have somebody to be able to maybe speak on that, I think is really impressive, and I appreciate that, and I know others will as well.
And she'll be speaking to people not only diagnosed with adenocarcinoma, which is more of the pancreatic cancer that people are familiar with, but also neuroendocrine. So there are two different kinds of cancer in the pancreas, and so she'll be able to, she sees patients with both diagnoses, so it'll be helpful to anyone, truly.
Yeah, it is, because a lot of times we kind of forget about the other one, and just because maybe it's a little less aggressive, or sometimes the survival rate can be a little bit longer. So it's something. I mean, it's just as important as the other. Like you say, they're the two different kinds. So
and often you're still having surgery in your pancreas, and so therefore your digestive system is challenged.
To put it mildly, I've heard it put a little differently, but yeah.
Yes.
The plumbing, replumbing is really screwed up in there. So,
Right.
so yeah, definitely. And who else can we look forward to seeing
Oh,
or hearing from?
so you may, Roberta, have a few years back listened to Dr. Muthuswamy, who's a gastroenterologist at UCLA. He runs the show over there, and he's talking about pancreatic cysts, diagnosing and treatment in 2023, because it changes. So he's last spoke with us on a patient and family webinar in 2021, but we're 2 years from that, and so he's also on a particular board where they make decisions about how aggressive or non-aggressive we should be when we find pancreatic cysts. So at some point, he's talked about in the past, anytime you go in and look at someone's pancreas, there's potential for finding a benign cyst. The question is, if something is precancerous, and in particular if there's a family history, what do we do? How do we treat that? And what's the particular surveillance for each patient? And so Dr. Muthuswamy is really going to be able to give us the latest information on how that's treated.
Well, good, because again, all the information you guys give, it's always amazing, and I just learn so much. You'd think by all this time, 20 years, I should know everything, right? But everything is changing, and you guys always it's such a great experience to go to the symposium and hear all these different things. So
yeah, and for people that are able to be there in person and walk up to the mic and ask questions, or at lunchtime, the doctors are happy to share more information, because a lot of people, we have a 10-minute Q&A, but it's also nice when the doctors are around to speak in more detail to patients in particular. But Dr. Muthuswamy, it's just, there's always a question of how aggressive should we be with these cysts, because you don't want to perform surgery that's not necessary, and then the question, of course, is, well, if we're not aggressive enough. And so those guidelines change, and he'll be able to share what the latest are, because with more and more early detection, we're going to find on that endoscopic ultrasound or the MRI, they're going to see something. So now what? And that's the big question. Now what do we do with that?
exactly, and a lot of times, because it is a cyst, sometimes they don't want to do anything other than watch it. And I don't know, to me that's really scary, watching anything that has a potential to be pancreatic cancer, just because of how fast it can grow and how fast it can change.
Yeah, one of my siblings is, we're watching a side branch IPMN, it's called. And so every other year it's measured and looked at, and then there's always a question of, well, do we do something or do we not? And so far, not. But that's always in the back of my mind. How aggressive we should or shouldn't be, because this is my blood, this is my family. So, yeah.
Well, it's very scary, because we don't know too, really, how long can a tumor lay there dormant and not even know it's there. That's what they think might have happened with my dad, just because by the time it was diagnosed, it was so huge that they're wondering just how many years did it lay there doing absolutely nothing. So to keep in touch, and I still think early detection is one of the most important tools that we can do.
Absolutely.
What other guests? Who else is going to be there? What else is going to be talking
Well,
about?
let me continue.
Yes, please. I'll try to be quiet so you can. I really want people to hear what you're having, because it's really amazing.
So Dr. Huey is going to be speaking. His topic is Integrative East-West Medicine to Optimize Health and Wellness. So these are some tools that, to really empower patients on what they can do for themselves. And so sometimes it's acupuncture, sometimes it's acupressure, other ways in which they can affect their health as they're going through treatment. And so Dr. Huey spoke years ago, prior to me being involved with the foundation, on this subject. And so to have him come back, he started the East-West Medicine division at UCLA, and he's the king over there. So we're excited to have him come and speak about what else we can do as a community for ourselves to make a difference, other ways in which we can help.
Yeah, I think it's important, because I don't know if it's a correlation or relation or not, but in my mind it is, I've done chemo for a number of years, but once I added the holistic approach, or different methods, that kind of changed. I mean, my last chemo was in December of 2018, and I started adding holistic medicine around the summertime. So to have gone for years just doing chemo. And then when I added these things like acupuncture, meditation, yoga, the herbs, the different things changed. And I actually have somebody coming in who will be talking about energy healing. I just did a session and it was amazing. So I can't wait to have her come in and talk about that. But is that something too he can kind of talk about those things as adding maybe changes here?
Absolutely. He's the one that will be able to talk not just from a Western medicine but Eastern perspective as well. So he definitely will be able to talk about that. And I'll talk later about someone on our panel who will also be speaking about that.
Will he be able to address a little bit about the use of cannabis? Is that something he's familiar with, or is that different?
I think that's a question to ask him. We've had someone before talk about cannabis from the UCLA department. At the time, they were really working hard to conduct clinical trials so they could have more information. So patients would speak anecdotally about how cannabis helped them with anxiety, depression, and getting a good night's sleep. But really, the doctors have to be able to turn to clinical trials and research in order to advance in this field. So certainly people talk about how it helps them. It'll be interesting I would like you to ask him that question. How can cannabis or CBD or CBN, any of these properties of the plant, help the cancer patient?
Yeah, and to be honest, I've used both and all probably. I mean, the lotion helps with neuropathy a little bit, and you know, if they want to get a clinical trial, I'll be the first on the list to volunteer.
Good to know. Good to know.
So if that ever comes up, so yeah, but I will definitely ask, because it is something I hear a lot, and it helped with my nausea, it really did. And so it's something that I really believe in. I just want to give that opportunity to others as well if they can.
I think that's a presentation for next year's symposium,
Good idea.
because we did it a few years prior, and so we have a patient and family webinar on our website about cannabis, and we also have I think in 2018, Dr. Jeffrey Chang, who was at UCLA at the time, spoke about it. So we have two presentations to be able to look at, but it'd be nice to get an updated version. Where are we in 2024 maybe?
Right, I think so. I agree.
Yeah.
I agree. Anyone else coming that we can?
Well, in fact, there is. Dr. Brand, who's also been at our symposium before. He's coming from the University of Pittsburgh Medical Center, and he's going to be speaking on a subject that I know is going to be important to a lot of patients and families, and that's, should I participate in a clinical trial? I can't tell you how many phone calls I get about people wanting direction about a clinical trial, and my surprise in the fact that their oncologists are not directing them either initially to choices on a clinical trial versus standard of care treatment, or when they finish standard of care, what may be coming down the pike that they can take advantage of. So there are all kinds of clinicaltrials.gov and other places to go for clinical trial information. But Dr. Brand is really going to try to steer the patient and family towards understanding what a clinical trial is. Should I participate? And if I'd like to participate, what are the steps I can take to do that? So.
Yeah, I think there's a lot of, unfortunately, misconceptions about clinical trials as well. I always run into them, and, you know, people always tell me, well, I'm afraid I'm going to get the placebo. Well, I try to explain to them, you won't get a placebo. You'll at least get the standard of care, and maybe the new drug is, you know, something you don't know, but you will never get the sugar pill or the placebo. And others are always saying, well, it's a last-ditch effort, when, you know, you try to explain to them that should be maybe the first thing you
That's
look at.
right.
Because that's the only way we are going to get our treatments is through clinical trials, unfortunately. You have to do this before the FDA will approve it. So it's very, very important. So anything we can do to kind of get that moving, I think would be very helpful as far as, you know, survival rate.
Yeah, I mean, it's just education. It comes down to education for, I mean, not only our community on knowing to ask their oncologist, you know, what else is potentially out there? What, you know, is there anything else going on within the university I'm at or out in the world? How they might look themselves if they feel like they're not getting those answers from their team themselves, which I would like to think they are, but if they're not, you know, ways in which they can approach this. So Dr. Brand, he's flying from Pittsburgh,
Oh, wow.
and he'll come spend some time with us. He'll be there the whole day. So
Oh, good, because yeah, it is. It's really hard. A lot of doctors don't. You ask them about a clinical trial, they either don't know, and maybe because they're just too involved with what they're doing, they don't have time to research it. But I would think they would at least have somebody that they could refer you to. Well, here's where you go to find out about clinical trials. So hopefully he can answer some of those questions, and that'd be an awesome way to.
yeah, and he's just a great guy. He's involved with the foundation and other areas. Our LA Cancer Challenge that we have each year, he's involved with the team. His sister's involved as well, and Debbie. So they're definitely friends of the foundation, and we're so appreciative of him flying out and sharing this information with us and spending the day.
Yeah, that's really great. And I do want to ask, because I know you can do this in person, but you can also, if you're not able to come for whatever reason, you're out of the area or just not feeling like you can do that, is there a virtual they can attend as well?
There is. When you go on our website, pancreatic.org, and click on the 17th Annual Symposium, you'll be able to see the full program that I'm sharing with you right now. And also you can sign up for in-person or virtual. So.
And is there a cost to attend the symposium?
No charge.
No charge for anybody?
No charge for anybody.
That's
We
awesome.
are. It's a beautiful conference center, and lunch is served, and we welcome everybody who wants to come and learn and share information. So no cost. We have wonderful sponsors like Living Hope,
Thank you.
a big important sponsor to the Hirschberg Foundation, and through that generosity and other families that give, and UCLA Surgery and NovaCure, we're able to put the event on at no charge.
I'm sorry. I just had a chemo brain. Sorry.
That's okay. I can share,
Please do. Fill me in here.
and I'd like to take over and continue.
Please do.
In 2 years, I've never seen her speechless. You left her speechless here. She didn't know what to say after that.
I don't
Okay.
know where I was going after that. It
I-
totally left me.
Well,
Please.
because I'm supposed to keep going. Okay. Okay, Roberta. Palliative care. It's not hospice. Is the name of Dr. Sachs's presentation. This is hugely important, like clinical trials, like integrative medicine, like nutrition, like everything else I've talked about. But palliative care is also not always understood. It's for symptom management. And really, a palliative care doctor should be considered to be on your team so that any symptoms that come up in the course of treatment can be dealt with. And so it's not hospice, it is not end-of-life issues, it is just managing symptoms while you're in treatment. And Dr. Sachs will come and share that information with us. So.
Well, I'm glad, because a lot of people, they confuse the two. They think that palliative care is just the next step to hospice, and it's not. I've used palliative care, and I'm still here. So, it's something that it does. It helps manage maybe the pain or diet or whatever you happen to be going through. So, and I've met other survivors who use it as well. So it is something very, very important. So I'm glad he's going to be able to come and speak on that.
Yeah, and we're at UCLA, we're the Aggie Hirshberg Center for Pancreatic Diseases. They do have the integrated practice unit. You go on clinic on Tuesdays. In clinic, there's a surgeon, a gastroenterologist, an oncologist, the genetic counselor, a lot of people looking at someone's medical information and charts, and then coming out and sharing what they think the best course of treatment is. Well, during that time, you get to meet with the dietitian, and palliative care is considered. But if you're at a medical center where that's not being offered, it's important to ask. It's important to ask about nutritionist, dietitian. It's
Right.
important to ask about palliative care, clinical trials. All of these things are to empower the patient and family as to what to do after diagnosis.
Well, I want to thank you for coming and joining us today. And sorry about that little.
What happened, Roberta?
The question, and now I remember the question now. But I do want to thank you for coming and sharing this, because I think it really is important for anybody who can to attend it, whether it's in person, virtually, and we'll give you the contact info again in just a few minutes. But at the end of each show, we dedicate the show, and today I actually want to dedicate it to you, to Aggie, to Lisa, to all those that are putting this thing together, all those guests that are coming, the ones flying in and just traveling, because it takes a lot of time, and I just really want to thank them for doing this, and thank you all. And today's show is dedicated to all you putting this symposium together.
Gosh.
So thank you.
Thank you for having me today. Thank you for letting me share the information. The only group I didn't get a chance to talk to was our panel discussion, perspectives from survivors and caregivers. So that's going to be really wonderful to have 2 survivors and 2 caregivers sharing at the end of the day about their journey and tips and advice.
And that's always very important. So I look forward to that as well.
And you've been on that panel before.
Yes, I have. And so has Vic. So
and
thank you.
so has Vic. This has been really wonderful. Thank you. I hope everyone can show up either in person or virtually, and the presentations will be on our website a few weeks after the event as well.
And give us the
Thank
date
you.
and location again and how they find it.
It's Saturday, March 11th at the UCLA Luskin Conference Center, and registration is required, and it's there's no charge, and it's on our website, pancreatic.org.
Okay.
So hurry and register before it fills up.
There you
right?
go.
Well, there you have it. One more resource to tap into. A real live event with real people there to answer your questions and tell you about a whole bunch of questions on your mind, or something you can attend virtually as well. If you want to know more about any of this, please contact Patient and Family Support Coordinator Amy Reiss at amy@pancreatic.org. That's easy to remember, pancreatic.org. Or you can call her at 310-473-5121. That's 310-473-5121. For me, thanks for joining us, and hope to see you there at the upcoming symposium as we continue to spread inspiration, hope, ideas, and inspiration like this through this weekly series we call Living Hope.